today. Now, first I'm going to wash my hands, and I need you to tell me your name and date of birth.
Tai Han, May 9th, 1994.
Okay, that's good. I'm going to start at your head and work my way down to your feet. So first I'm going to start at your scalp. Can you lower your head, please? Okay, I'm checking to see if there's any lesions or depressions or any abnormalities, and I don't see any, and your scalp is moist, so that's good. You can raise your head. Next, I will be palpating your sinuses. I will palpate your maxillary, and then I will palpate your frontal. Okay, I just want you to tell me if you feel any tenderness.
No. No.
Okay. Next, I'm just looking to see if your face is bilaterally symmetrical, which it is. And now I am going to check your cranial nerve number 7, which is your facial nerves. I just need you to smile for me. Okay, good. Now I need you to puff out your cheeks for me. That's good. Now I'm checking your cranial nerve number 5, which is your tegmental nerve. And I'm going to take out this piece of cotton. I want to have you close your eyes. And I'm going to touch this cotton to your face, and I just want you to tell me when you feel it.
Yes. 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 Yes.
Okay, that is good. Now I'm going to be moving on to your eyes. I'm going to need you to take off your glasses. I'm going to check and see if your conjunctiva is pink and moist. That's good. And your sclera is white and moist. That's good. And your eyes are bilaterally symmetrical and round. And next, I will take out my pen light, and I want to check to see how your your pupils respond to light. Okay, that's good. Next, I am going to do your visual acuity. What I need you to do is just follow my pen without moving your head. Okay, that's good. You can now put on your glasses. Next, will be doing checking your cranial nerve number 2, and we will be looking at the Snellen chart. And I would have you cover one eye, and then I would have you read until you can get to the lowest line you can read. And after that, now I will be doing. Oh, you can put your hand down now. Okay, next I will be checking your nose, and I want to take out my pen light, and I want to shine it up your nose, and I'm just going to check your mucous membranes and make sure they're pink and moist. Okay, that's good. They're pink and moist, and now I just need you to flare your nostrils. Okay, that's good. They flare symmetrically, and now I'm going to check your patency, and how I'm going to do that is I want to hold one nostril, and then I want you to sniff, and I want to hold another nostril, and I'll have you sniff again. Okay, that's good. There's no blockage or anything. And now I'm going to check your mouth. I'm just going to have you open your mouth. Okay, and lift your tongue. And can you move it side to side? Okay, that's good. And now I want you to say ah.
Ah.
Okay, and I see that your lips are pink and moist and they're not cracked, so that's good. Next, I will be checking your cheeks, so can you open? And they're pink and moist, and your gums are also, and there's no white spots, so that's good. And your teeth are straight and white, so that's good. And now I'm going to check your uvula and your tonsils, and they are intact and symmetrical to your mouth. Okay, you can close your mouth now. And Now I'll be looking at your ears. I'm going to be palpating them and checking for any lesions. Okay. There wasn't any lesions. Was there any tenderness?
No.
No? Okay, now I'm going to check the inside for any discharge. Okay. And that looks good. There's no discharge. Now I will be checking your hearing acuity, which is for your cranial nerve number 8. And I'm going to cover one ear and then whisper something in your other, and I just want you to repeat, okay?
1, 2, 3. 5, 6, 7.
Okay, that's good. Next, I will be checking your neck. I will be looking at your trachea to see if it's in the midline of your body, which it is. Next, I will be looking at your thyroid to make sure there's no masses or enlargements. And I will be listening for carotid bruit. Okay, I will be listening for it. Okay, I did not hear anything out of normal, but if I did hear one, it would indicate that you had a lesion or stenosis, which means that it would be narrowing of the vessel, or there could be a blockage. Next, I'll be checking your cranial nerve number 11, which is your spinal accessory nerve. Okay? I want to put my hands on your shoulders, and then I want to push down, and I just want you to try to lift your shoulders. Okay, that's good. Now I'm going to put my hand on your cheek, and I'm going to push against your cheek, and I just want you to push against my hand. Okay, that's good. Now I'm going to do it on the side. Okay, that's good. Now, next I want to inspect and palpate your thorax. I'm checking to see the color consistency with the rest of your body, and then that's good. And now I want to, I also check for if there was moisture, which there was none. And now I'm just going to need you to take a deep breath. Okay, that's good. I didn't see any, you using any of your accessory muscles, so that's good. And I didn't hear any wheezing or crackles, so that's also good. And your lungs expanded symmetrically. Next, I will be auscultating your lungs. Okay, hold on. I will auscultate them in 5 spots on each side. Just keep breathing. Okay, that's good. I don't hear any wheezing or bronchi. Okay, next we're going to move on to talking about your monthly breast exam that you can do yourself. You will need to do this at least one time a month, and you will do this after your period or the 4th through 7th day of your menstrual cycle. You will need to do this in the shower or lying down, and what you do is you put your hand behind your head like that, and you will start at the axillary, and then you make a circular motion and feel for any lumps. And when you get to the nipple, you want to pinch it and see if there's any discharge. Now, if you have any tenderness, any lumps, or any discharge, you will need to contact your doctor as soon as possible. Next, I will check your left chest for pulsations. Okay, that's good. Okay, now I'm going to be listening to your heart, which is in the 2nd and 5th intercostal spaces. And I will be listening to all your valve sounds. And I will start right in the sternum. Second in the intercostal space is the aortic valve, and then left is the pulmonic valve, and then underneath that is in the third intercostal space is the Erb's point, and then under that is the fourth intercostal space, and that is the tricuspid valve, and in the fifth it's the bicuspid valve, and oh, I'm sorry. I need to listen to your apical pulse in the fifth intercostal space up mid-long the clap. Okay. Good thing I didn't hear any murmurs or irregular rhythms, and everything sounded great. Next, I'm going to go behind you and check in your posterior thorax and check for any curvatures of the spine or any abnormalities. That's good. Now, I seen that your skin color was consistent with the rest of your body. Now I will go back and I will also take your lungs. And turn it around. Thank you. And normally I would do this 9 times on each lung. But I see that your lungs expanded symmetrically. Next, I will inspect and palpate your upper extremities. Can I see your arms, please? Okay. I see there's no edema, lesions, or abnormalities. And I see that I checked your temperature and your moisture, and that's all good. Next, I will be checking your capillary refill, and I'm going to push on your nail, and your color should come back in 1 to 3 seconds. Okay, that was good, so there's no clubbing. And next, I'm going to check and make sure there's no turgor or tinting. That's good. And now I'm going to palpate your brachial and radial pulses. Okay, that's good, and they are bilaterally symmetrical. Next, I will be testing your deep tendon reflexes. I will knock on your bicep and your tricep and then your brachial radius. Okay. And normally I would do that on both sides. And next we are going to check your range of motion, and all I want you to do is copy me. Okay? Like this. And this. This. And this. Okay. Next, I will be testing your neurological sensation. And what I need you to do is give me your arm, and I'm going to have you close your eyes, and I'm going to have you tell me if it's the dull side or the sharp side. Okay?
Dull. Sharp.
Okay. That's good. Now I will have you lay down on the bed, please. Okay.